weight and a healthy lifestyle. But for some people, no matter how strictly you adhere to a diet, those pounds won't come off. It was this dilemma that led to one physician to conceive the idea of a blood type diet under the assumption that our bodies process food differently based on our divergent blood types. So, make sure you don't miss out on the segment where we're going to take a look at food-blood compatibility. Thanks for staying with us on Health Options. Our policy track segment is taking a look at the trend of high maternal and child mortality in Nigeria. We take this background report on the factors responsible for Nigeria's high maternal and child mortality, put together by Uche Ugochukwu.
Under 5, maternal mortality rates have remained high in Nigeria despite interventions, although child mortality rates reduced by 20.4% from 27 deaths per 1,000 live births in 2013 to 24 deaths per 1,000 live births in 2015. To reverse this trend, experts advocate the identification of barriers to quality child and maternal health care towards proffering a lasting solution. Deaths in the first 28 days of life is linked to genetically induced malfunctions, premature births, status of a child, quality of antenatal care, which is whether there were skilled care before, during and after births. Deaths in the succeeding 11 months are associated with the wealth status of the household, environmental factors such as the cooking fuels, which lead to acute pneumonia and lower respiratory infections. Also, health, behavior, and nutritional practices were identified. Other factors include maternal education, early marriage, short birth intervals, breastfeeding practices, proximity of health facility, inadequate skilled health attendants, religion, and cultural practices. These impending factors must be given prompt attention for Nigeria to meet the Sustainable Development Goals targets for maternal and child mortality, in spite of the recorded success in the reduction of child mortality.
To take us through the discussion is the Executive Director and Chief Executive Officer of the National Primary Healthcare Development Agency, Dr. Faisal Shoaib. It's good to have you again join us on Health Options, Dr. Faisal.
Thank you for having me, Rabi.
Nigeria's high maternal and child mortality is an unacceptable situation. When you look at the fact that these deaths are 70% of these deaths are preventable. We read out the statistics out there during my introduction. But can you, maybe just give us some more, especially when it comes to the number of deaths occurring per live births?
And this has, made us at the Federal Ministry of Health, the National Primary Healthcare Development Agency, to say we cannot continue at this pace. We're not talking about chickens, we're not talking about rabbits, we're talking about human beings. Even one death is a death too much.
You know, what really is amazing to me, is the fact that we've had a lot of interventions. So much investment has gone into, reversing the trend for so long. Why are we now making, seeing the desired results?
Right.
What happened to all those huge investments to ensure safe motherhood?
So, like I mentioned, right, we've made some progress, but the progress is not significant enough.
Why is the progress not significant?
A number of reasons. So, we still have issues around the lack of awareness. So, we still have women who get pregnant and do not go for antenatal care. They will rather deliver at home. There isn't enough skilled birth attendants to attend to these women. So, we now have these women who go into a bleeding event. Bleeding is the commonest cause of these deaths. When this bleeding occurs in the community, before they take the mothers to the health facility. That's bleeding
after delivery?
Yes. So, bleeding can happen even during pregnancy. Okay. But most times it is around childbirth that you have bleeding, and then after childbirth. That is the common cause of dying during childbirth. When that happens, there's no way to replace the blood, and the women die. If these births were occurring in a health facility, then of course the danger signs are there. There are trained personnel who will be able to ensure that those bleeding does not occur. If it occurs, there are ways to avoid it from claiming the life of the mother.
In terms of demand and supply, there has been concerted efforts in the past to provide commodities, essential commodities that will ensure that women have their babies without complications. So such that even when the complications arise, they should be able to, mitigate or stem them. What happened? Is it that we're not having those commodities anymore?
So you can have the commodities, right?
Yes.
In the health facilities, for example. But if the mothers do not come to the health facilities, there's a problem. This is how. This is what brings us to the critical reasons why we're losing women in our communities. The 3 delays. The first delay is the delay to take a decision to seek care, right?
Yes.
The second delay is the delay in reaching care. The third delay is that even when you reach where you should get care, getting good quality care becomes a challenge. So when you look at all of these delays, you can see that there are issues that are related to demand. So for the woman to leave her home and get to the health facility, taking that decision with her husband to leave the home when there are danger signs in pregnancy could be huge. It could be due to financial reasons, right? It could be to a number of cultural reasons where women still feel that it is a show of strength and ability to have their babies all by themselves. Sometimes they don't even tell people that they are having childbirth. Yes, they're in labor, right? In a lot of our rural communities, this still happens, right? Then there's also the issue that even when they take the decision to go to the health facility, they are not able to reach the health facility in time due to a number of reasons. It could be geographic reasons, right? Exactly. It takes time. There's no transportation, or they live in rural areas, or they could be in riverine areas where getting help is difficult.
Okay, so we are in an era now. I'm just talking about the emergency, the state of emergency that had been, the agency just declared on the phenomenon. Let us into the new approach. What is it about? You're talking about, setting up a coordination center where you could track these deaths and find the causes and hold people accountable for actions and all of that. Can you tell Nigerians what is this new way of doing things that should give us that confidence that in no time we should see the instances coming down?
Right. So in collaboration with the Federal Ministry of Health and under the leadership of the Honorable Minister of Health, Professor Isaac Adewale, we're setting up a center that we call the National Emergency Maternal and Child Health Intervention Center, where we will provide better coordination of all the efforts. In the last few decades, what we have seen are disparate, fragmented approaches, not only from governments, federal, state, but also our development partners, who will come, take 3 LGAs here, take 2 LGAs in this state, run a program or a project rather for a few years, maybe 2-3 years, they leave, and there's no continuity. What we're saying now is whatever lessons we have learned, how can we, sitting together, develop one plan? And on that plan, we all align behind those plans, pull all the resources, right, that are required to rapidly implement the high-impact interventions. We know what those high-impact interventions are. Can we do it together in a coordinated way and pulling all those resources on the table in a transparent way and holding people accountable? So, for example, in terms of accountability, we've now gone into a partnership with the Gavi, with the Global Alliance for Vaccine and Immunization, with Airtel, to provide 10 toll-free lines where in the community, if any woman dies, if any child under 5 dies, they can call NPACDA. We will triage these calls to the state primary health care boards, the state ministries of health, and find out what happened. Was it due to negligence at the primary health care level? Was it that in the communities, right, the traditional leaders are there, and we're collaborating with them, and they say that if any woman dies in the community, questions should be asked of the traditional leader, of the political leaders, of the opinion leaders. Why is it that when these women started showing the danger signs, all efforts were not mobilized to take her to the health facilities? When we have these kinds of reports coming in on a regular basis and people are investigating, then people will take note, right?
Yeah.
When we hold people accountable, we will, of course, reward those people who are doing the work the right way. But if people are negligent, then we will collaborate with the state governments. We will collaborate with the local governments to ensure that the right things are done. And this fits into the Basic Healthcare Provision Fund that has been provided by President Muhammadu Buhari to ensure that while on the one hand we're encouraging women to come for antenatal care, when they do go to the health facilities, that the commodities are there, the manpower is there to ensure that they receive care with dignity, with compassion, with integrity.
It's about, reduction by 50% by the year 2021.
Right.
And from what we're seeing now, you said at primary health care levels, we know that occurs, pregnancy-related complications occur even in the urban areas, regardless of. So how are we going to extend that to those other facilities?
Right. So the National Strategic Health Development Plan 2, right, that was provided by the Federal Ministry of Health under the leadership of the minister is very clear about what the roles and responsibilities of the primary healthcare development agency is. Most of these deaths occur in the communities. Over 70% of these deaths occur within the communities and the primary healthcare centers. That is why we say if we focus our resources there, right, it's easier for us to rapidly crash those deaths. In the secondary and tertiary healthcare centers, of course, we have better manpower in those areas, and we can look at what else we can do, working with all the development partners under one plan. Yes, we've said that we want to reduce these numbers by half by 2021. It is in line with what the Federal Ministry of Health has espoused, but we also are saying that it's either we go bold or we go home. We have to be ambitious because as a nation, these numbers we're seeing does not match our resources. It doesn't match the human resources. It doesn't match our financial resources. We can do better. And what we're saying is that we're going to raise the awareness. We're raising the ante and saying that we can do better. We cannot let our women continue to die in the communities.
Okay, as you coordinate, the states, the local governments also have their roles to play. How are you going to secure their buy-in into this new way, this new approach to reversing the trend of high maternal and child mortality?
From the get-go, in our conversations, we started from bottom up. So the states and the local government have been involved in these conversations. In our declaration, we had executive secretaries of the primary healthcare boards sitting there. They are completely aligned around the fact that enough is now enough. We have to do things differently. If we continue at the rate that we're going, of course, we're making some progress, but if we continue to reduce maternal and child mortality by approximately 5 to 6% every year, we will miss the Sustainable Development Goals target. So we have to improve on the rate at which we reduce maternal mortality. When we look at what has happened in other countries that have rapidly reduced maternal mortality, in the course of 5 years, the best we have seen is in a place like Botswana, where they reduced it by 53% over 5 years, right? So that is what we're trying to target. We're working with the states. We'll advocate to the governors, we'll advocate to the chairman, but we also want to advocate with the wives of the governors.
I was
to
going
make
to
it
that, as mothers, as
absolutely. We are going to make this the center of discussion, and we've seen from what the First Lady of Mrs. Aisha Buhari, she is very passionate about all issues relating to women, children, and reproductive health. We have been in conversation with her office. We're going to be working with her office and the offices of the First Ladies of the 36 states plus the Federal Capital Territory to see how they can bring, their nature to also get a better understanding and raise the clarion call that the time is now here for us to do better than what we're doing. And we are capable of doing it. So under the leadership of the Honorable Minister of Health, Professor Isaac Adewale, we are very positive that we'll make the huge investments that are necessary, and we will concomitantly see a rapid decline in the number of women that are dying, in the number of women and children that are dying from perfectly preventable causes.
Okay. On a more cheering note now, I discovered that we've been making some progress on routine immunization. What's the secret?
So this is what gives us confidence that we're going to be successful with crashing down the numbers of women and children dying, because we're using the same war room approach where everybody comes. We are moving from just strategies to actual execution. We are some 5 months away from being declared polio-free in Nigeria. We have increased routine immunization within a record period from some 47% in 2015. We have increased it to 57%. It's the same methodology that we used in stopping Ebola virus disease in a struck in 2014. Those same strategies, those same rigorous execution and delivery is what we're going to use in crashing down maternal and child mortality.
This renewed vigor in reversing the trend, one is expecting that you and your team want to just hit the ground running from this moment. What are some of those things you've already started to put in place following that declaration?
Right, so we had our inaugural meeting with our development partners. We've set out all the different committees. We've looked and set out a work plan that will say very clearly when we must achieve particular milestones. We're reaching out to our development partners to provide support. We're also reaching out to our traditional and religious leaders. They are going to be very key in changing the behavior of our women, our men in the communities.
Health-seeking behaviors,
absolutely,
for pregnant
yes,
women.
Absolutely, they are going to be very, very key. That is why they are with us in the trenches. The Sultan of Sokoto is very passionate about this. We are with King Alfred of Bayelsa. Absolutely, they are very excited about all what we're doing. There are a few states where a lot of things have been done. There's no state that has excellent maternal and child health records. So some states are worse off than others, with every stakeholder to ensure that when the ranking of states and countries with poor maternal and child indices are reeled out, Nigeria does not continue to occupy a high rank.
So it will be right to say that it's the dawn of a new era for pregnant women and ensuring safe motherhood in the country.
You better believe it.
Okay, thank you so much, Dr. Faisal, for coming on Health Options again.
Thank you very much.
All right. Do you know your blood group and the food that is compatible with it? Let's find out.
Most of the time when we take food, it dissolves. It's either the food acts as a poison to the organs, or the food acts very beneficial in an atmosphere that the organs that are suspended, the cells, will be at the optimal performance. We have 4 major blood groups. It is not accidental. God has a purpose for it. And these 4 major blood groups, the major ones is either you are A, you are AB, you are O, and you are B. Irrespective of your race, it has a reason. And when you now look at it, the food has the blood has antigens that the chemical substance in food do react to. And this goes a long way to determine a lot of factors, a lot of components that can be of good health and that can be of ill health. The knowledge of your blood group compatibility. A positive person, by nature, by God's existence, you are meant to be a vegetarian. The blood is compatible with vegetables. Most of the time, as a H-positive person, yes, you are active. Your blood is so sensitive. And whenever you take anything that is not of vegetable origin, most of the time, it's either it's not beneficial to you or it serves as a poison. As O-positive person, for example, they are carnivorous naturally. They need meat. Meanwhile, as a positive person, meat acts like a poison to you. Most of the time, the blood group compatibility actually goes a long way. For example, a positive person, you are not the type that should be involved in too much physical activity. Once you understand your blood group and what is compatible with your blood group, it goes a long way. I indulge women, learn about the blood group of your child. If a positive person can do without meat, you will, and stay more of the fish and more of vegetables, it goes a long way. As O positive person, you need the meat. They are naturally carnivorous and they are more physical. They need a lot of physical exercises to be hale and hearty. And now you are a positive person, you want to compare yourself with an O person. No. Alkalinity affects A positive more than anybody. And most of the time when the food is not incongruent with the blood, for an A positive person, autoimmunity problem is their challenges. And that's why they develop a lot of autoimmune system. They develop, cancer is a major thing that can develop continuous acidity of a typical A+ person. An A positive person needs an alkaline environment, and that's why it's advisable, even if it is lemon in your water every day, it will take you a long way that you will avoid going to hospital. We are not saying people should not go to the hospital. Yes, it's good to go to the hospital to do some basic major tests, but the workload on our hospital will definitely reduce by the knowledge of this compatibility with your blood type. But all positive persons, see, they do well in a meat environment. It's not that too much of it is not good, but you cannot afford to be a vegetarian as an O positive person because you need this meat in you. So by understanding your blood group, you know your challenges. And most of the problem of O positive is their gastric acid. Most of them suffer from ulcer. At least about 70% of them, ulcer is a major problem. I am A positive, I am B positive, I am O positive. And these are the likely things that an O positive challenges they face health-wise. Because majorly ulcer, B people, they have problem with their BP, their sugar. That's the common problem they do have. What is your blood group? What is that type of exercise that is good with your blood? What is that food that I do like and I've been taking? And actually it is more harmful. So naturally, as a person, it goes a long way to help us in sustaining a healthy life. Knowing your blood group helps you to know the type of diseases or problems that you might likely face and challenges. So when a typical B person now knows that, okay, the problem I might likely face is a BP problem and sugar problem. So as early as possible, you have to be very cautious of it. And that's why you see most B, by the time they are 50, they are likely to be hypertensive and diabetic if they are not conscious of what they do.
This is where we end it on this week's edition of Health Options. You can watch the upload of these and other episodes of the program. Email us for your comments and contributions at healthoptions@nta.gov.ng. My name is Rabi Abdullah. Thanks for watching. Hope to see you again.
NTA. You can't beat the rich.
Dab. Yes. One day as I did dab, they go. Now I see my neighbor on top electric pole. Don't be hammer you hold so.
Before, so
Climb every day. Come on, electric bill. You not gree pay.
waiting concern you for there. I beg you, come over here.
Okay, oh. I don't talk my own. As I dab reach house. Yay! Fire! Fire! My brand new flat screen.
Hold up.
Waiting concern you for there. I beg you, come over here.
Government property, now my property. If you don't come down now, I go report.
Don't be only report. Now report card.
Dab. Yes.
NTA Parliament is a dedicated 24-hour channel that broadcasts the activities of the Nigerian Senate, Federal House of Representatives, and all the 36 state houses of assembly. You can watch NTA Parliament on NTA StarTimes DDT platform. NTA Parliament, strengthening Nigeria's democracy.
NTAE brings you the best of entertainment.
I thought I was being sarcastic.
I went on to do other productions.
Everything music.
Hear what which one you say.
Hello and welcome once more to the news update at 11. I'm Comfort Amodu. The Federal Executive Council has approved about 500 million naira for the procurement of memory access to retrieval system to enhance safety in the aviation sector. And 75,000 young Nigerians are to benefit as the country moves to build a crop of competent and skilled workforce through the N-Build program.
The contract for the Southeast Zone of Nigeria was awarded in the sum of 122,800,000 naira. Then the one for the Northwest Zone, Empower Build Northwest Zone, it in the sum of 145,106,170.
And following the killings in Zamfara State, the Senate has resolved to appropriate 10 billion naira for the victims to cushion the effects of the social dislocation. The Senate also urged federal government to constitute a presidential committee on the crisis.
Command all Nigerians who, irrespective of cultural, religious and tribal differences, came out in their numbers to show solidarity to the plight of their brothers and sisters in Zamfara State.
So I must also commend the media. Today, almost all the newspapers in Nigeria made efforts to report about the problems in Zamfara.
Permanent Secretary Minister of Education, Sonny Echono, has inaugurated a technical committee to review the national policy on albinism with a view to protecting and making albinos equal to other members of the Nigerian society in terms of rights. Abdullahi Musa Suleja reports that the committee is co-chaired between a director in the Ministry of Education and the National President Albino Foundation, Jack Ekpele.
Reviewing the policy will equally facilitate adequate planning and allocation of resources to albinism issues in Nigeria. It will empower such persons the various organizations in the sector and the decision makers on issues of albinism and the development of effective inclusion and participation.
And that's the news update. On top of the hour, join us for more updates by 1 p.m. I'm Comfort Amudo. Thanks for watching.
Progressive society depends heavily on efficient roads, the flyovers, pedestrian bridges, and other infrastructures. Much as it is the job of the government to provide this, citizens must work with the government to bring sanity on them, especially our roads. Welcome to Road Matters. I am Fatima Omar, and today on the program, we'll look closely at the menace of wrong-way driving. It is illegal, unlawful, and dangerous, but it has almost become a norm. What is responsible for this obviously uncivilized attitude? How can this be curbed for the safety of road users? Stay tuned.
Wrong-way driving has been a subject of intense scrutiny over the past decades. It crashes occur when the driver intentionally or unintentionally drives in the opposite direction of traffic. It has been a constant traffic safety problem on the road. These crashes could lead to fatal or severe injuries or even deaths. These collisions are most often head-on, which of course tend to leave motorists traumatized. It is a daily occurrence, especially when traffic is tight on one side of the road, and citizens sometimes put the blame on officials assigned to manage traffic and maintain law and order on the road. Here is an eyewitness clip on the situation he encountered.
From Mogadishu cantonment towards Nyanya, this is the first overhead bridge. Coming from Nyanya, the Federal Road Safety Corps has a duty post, and on the other side of the road going to Nyanya, there is a police post. In between, there is a starting point on the police post side from where the Okada riders take off in large number and defiantly facing the traffic coming from Mogadishu cantonment, who have the right of way. The police sit leisurely behind their post as the Okada riders have their way. The Federal Road Safety Corps, on their side, sometimes are busy checking vehicles and paying no attention on the Okada riders moving against the traffic on the other side of the road. Rumor is that the Okada riders pay weekly to law enforcement agencies to remain in the business of disobeying traffic regulations. When will change take place in the face of this agreement between lawbreakers and law enforcement agencies?
Are the officials responsible turning a blind eye to indiscipline on the road?
The issue of driving against the traffic, which is popularly called driving against one way here in our country. We also have things like willful and deliberate disobedience to road traffic signs. There are clear laws. As a matter of fact, when you drive against the traffic, driving against the traffic is prohibited under the Road Traffic Act, and it becomes a complicated matter. If in the course of driving against the traffic, you are involved in an accident, you damage someone's vehicle, or you damage government property, or you get someone injured, or you get someone killed. As a matter of fact, if someone dies, that becomes even more complicated. It becomes a fatal motor accident, and it will be treated that way. There are rules that regulate that, but it's a serious matter because you could face manslaughter charges in the court of law. It becomes a homicidal matter, and then it will be treated appropriately. Just like the kind of training that lawyers get. We are made to understand that it is better for 99 criminals to escape than for one innocent person to be unduly harmed, to be unnecessarily harmed. Sometimes why we don't chase people when they commit traffic offenses could be because we are trying to prevent a bigger disaster. So if I see if it's a scenario where I have assessed the situation, and in my judgment, I believe that a pursuit of this man could actually lead to a greater accident or a greater fatality, I will let him go. I will take his plate number. Even if I'm unable to get his plate number, I will still let him go and save the society from greater harm and greater collateral damage. That's the way we work. When you set out on a patrol, for example, we don't expect you to arrest all the bad boys in a single day. But keep arresting, keep investigating, keep prosecuting, and we'll be taking them out of circulation one after the other. People, because someone has just brushed them and the person refused to stop, go on hot pursuits. And sometimes chasing another driver and driving up to 120, 140 kilometers per hour, trying to catch up with another mad and reckless driver. And sometimes they think they're actually trying to instill discipline, but they are also exhibiting another round of madness and indiscipline. Apart from lack of proper education, you also look at things like drug abuse. When people are under the influence of substances, it doesn't matter what you say to them. It doesn't matter how bold the road signs are. The tendency and the chances or the possibility for them of them breaking the rules are very high because their sense of judgment is impaired. Their capacity to think through is affected negatively. And so you are dealing with someone who is not thinking right and acting right. You also have the tendency of big manism. There are people in this country that just believe that they are VIPs. And so they believe every other person must give them priority when they're on the road. They believe they're above the laws of the land. They believe every other vehicle must get off the road for them to pass unimpeded and unhindered. So if a police officer, for example, is arrested driving against traffic, I expect that he should also be disciplined internally through the orderly room process If he's a senior police officer, he should be queried. And then through that way again, we will send a strong message that our respective institutions, the police, the military, the civil defense, the customs, the immigration, and the rest of us will not or do not, as institutions, encourage the disobedience of our traffic laws and regulation. As long as perpetrators of offenses or as long as violators of our traffic laws are allowed to go unpunished, are allowed to go unprosecuted, there will be no disincentive or there will be no incentive for them to stop. So we must bring violators of our traffic laws to book. We must ensure that they are arrested, investigated, prosecuted, and made to pay heavy fines, or even in extreme cases, made to either serve jail terms or be compelled to perform community services. And if we can do that, we'll be able to put a check to some of the unnecessary breaches.
The road safety assigned with the sole responsibility of keeping the roads safe could be held accountable, since they also control traffic for safety of road users.
If somebody will come out and tell me that they used to bribe our staff who are controlling traffic in Nyanya to take one way, I am not somebody that is very fast in saying no to it. Neither will I say yes to it. In all the complaints I have received in issue of taking one way in Nyanya, has always been that there are people who feel they are untouchable, they will not want to follow the right route. They will take one way maybe because of hold up along the major route they are applying. They will now burst out after sharp corner from where they do take the one way. But in any case, we do send surveillance out to monitor the activities of our men. These surveillance activities that I'm talking about, of course, our men, they know that anybody that is arrested with any bribe case, and it is proved beyond reasonable doubt, in any case, when we arrest you with bribe, we have evidence to show anywhere, then you should be prepared to leave the job, because the end result is you'll be terminated. The books are there to guide us. We have what we call the maintenance of discipline. So that book guides us. So whatever offense you commit, you've already known the repercussion. Once it's proved beyond reasonable doubt that that offense is committed, certainly the law will take its course on you. So we don't joke with issues of bribe. We don't joke with issues of behaviors that are against our operational ethics when we are out there on operations. We don't joke with them. People are just being very, very impatient. You have a small traffic hold-up in a particular location. You are in a haste. I want to go to where I'm going because maybe such people they didn't wake up on time to meet up with their appointments. But what we keep on saying, or what we tell people, is that, look, you have an appointment by 8 o'clock. Leave your house latest by 6 o'clock in the morning. Plus or minus. You will have known how many minutes you will spend in a particular place. Because this traffic will not tell you, I'll be heavy today, I'll be light today. It won't tell you. It's only when you go out. So to avoid such a situation and to meet up with your appointment, then you need to leave in good time, so that you can hit the roads where you have traffic hold up, exercise some patience. There's nothing like maneuvering like James Bond to get your way out. No. Just, look, driving requires patience. Anything short of that is the kind of thing we are talking about taking one way. If there are uniformed men that are doing that, it's a very bad one, because people are supposed to learn from them. We are the custodians of the law. We are enforcing the law. And when we are enforcing these laws, courtesy demand that we should do the right thing. I should not be the person who is enforcing and the same person who is breaking it. It is very, very bad. And it doesn't tell well. And nobody is above any law. Anybody that is caught taking one way, that is outright route violation. It's a route violation offense. And a route violation offense is only 5,000 naira. That is the offense. But there's something that is added there. Since 1st July 2017, anybody caught committing that offense, road violation, apart from paying the fines that will be booked him, he must in capital letter or bolded to those who are good in computer, must go to the hospital for emotional evaluation. He must go and do that evaluation in the hospital. And it's not just any hospital the person goes to. We have only 4 hospitals within the city center that we honor their results. Federal Medical Center, Jabi, National Hospital, Garki General Hospital, and the Nigerian Police Force Hospital in Area 1. These are the 4 hospitals within the city center that we honor the test, the results. Any hospital outside these ones, within the city center, no. You have to go to any of these that I have mentioned. So, rule violation is a critical offense. It is not the only one that we send people to hospital. We have people who use phone. They are also sent to the hospital for that evaluation. We have people who beat traffic lights. They are also sent to the hospital. We have people who drive dangerously. They are also sent to the hospital. I don't look at it as a mistake. It's intentional. Because that is not the road you are supposed to take. You are facing oncoming traffic. It is wrong. And we do advise, if I'm a pedestrian, I am trekking, courtesy demands that I should face oncoming traffic, not back oncoming traffic, because I am trekking. So if I am facing oncoming traffic, you know, it means you've taken a wrong route. It means you are coming behind me. I am not seeing you. And you now come and knock me down and I'm dead. You should be treated like a murderer. That is my own take there. It's really a criminal case. And the person cannot get out of it. Because you must explain to us. Why didn't you follow this way to go and take a turn to where you are going? Oh, you feel that it's a shortcut for you. Perhaps that shortcut could be to 6 feet deep. So that is the way I look at it. But honestly speaking, it doesn't tell well. People should learn. People should learn to do what is right. When you do what is right, and the unexpected happen, nobody will say you are the genesis, you are the cause. But rather, people will just be praying for you.
It has become a pain for motorists, especially on roads prone to human and vehicular movement across the country. Car owners and commercial drivers, as well as motorcyclists, popularly known as Okada riders, indulge in this act, even knowing it is dangerous.
One thing people fail to understand here is that when the unexpected is about to happen, it does not know whether I'm a corps commander in road safety or I'm a 3-star general in the Nigerian army or in the military. You do what is wrong on these roads. Like I do say, the roads are very, very patient. But it does not forgive those that make mistakes. Go out, make that mistake, it catches up with you. So there's no respect. It's only me and you as human beings. When we say ourselves, we respect ourselves. But the road does not know that. You've done what is wrong, you pay for the consequences of what you have done. And that is a fact.
In Nigeria, a lot of people don't attend driving schools. They grow up, stumble into money, buy their vehicles, just get someone to teach them the basics of driving, and whoop, they jump into the steering. And then they begin to drive. So sometimes they are illiterates, in quotes, when it comes to reading road signs. They don't even understand roads, basic road signs. And so they break these laws at random, sometimes ignorantly. So we must begin to look at proper education for drivers and road users. The practice of people getting licenses, sometimes in proxy, must be put an end. And I'm glad that the road safety, the Federal Road Safety Corps is doing a whole lot in this regard, streamlining our licensing processes and making sure driver's licenses are issued to only persons who are fit and proper to drive, persons who are very qualified. And this is a challenge to law enforcement agents. We must enforce the law without fear and without favor. We must be firm and impartial in enforcing the laws. We must ensure that the same laws are applicable to the big, the small, the rich, and the poor. That's the only way we can tackle impunity. That's the only way we can make sure that people who think that they're above the law are brought down and made to know that we are all equal before our laws.
It is the most terrifying sight for most drivers. Imagine driving down the highway and suddenly a car or a truck is heading straight towards you, driving the wrong direction in your lane, your own lane. Annoying and dangerous. While the officials try to control this havoc, as a road user, it is important to not only know the traffic rules and regulations, but to obey them. As usual, here are some tips for safety on the road.
When driving and you find another driver in the opposite direction of traffic, flash your high beam to try to get their attention and pull over to the side of the road immediately. Always look out for road signs like wrong way or one way. You may be able to avoid an accident. Make sure you are on your lane and be disciplined enough to direct others when driving on the wrong way. Pay attention to the road and cars. Be aware of your surroundings. Then the likelihood of making a wrong turn will be very low. When you are driving on the wrong way, going to the wrong direction, you have made another mistake that could cause a crash. Apologize and turn the right way. Arguing or trying to own the road could lead to road rage, which can be even more dangerous. Keep in mind, no driver owns the road. Allow the officials if you see any acts of road indiscipline for proper and effective management of situations. Have patience on the road. The good driver is the one who gets home safe.
Officials concerned are on the road to curb this menace. But it is a situation that happens often that it has become a problem in our country. Let's stop driving the wrong way and taking one way. This is where we end the program today. You can stay in touch with the program on Twitter or send a mail. And if you find something happening in your area, send a clip to the program. We appreciate the feedback. And join us next week for another interesting topic. I am Fatima Umar. Be the change you want to see on the road. Bye-bye.